Imagine being a parent in a consistent cycle where you become ill with weakness, difficulty breathing, and pain overall while you can't help yourself or even your children who are enduring the same thing. What if you can't find a doctor? Or what if you don't even know why you feel this way? Having access to this information can help aid those who suffer in silence. For our presentation today, we will be speaking about nutritional anemia and proposing a solution to treat it in Bauchi State, Nigeria. Before we begin, I would like to introduce our team and present the outline of what we are going to be speaking about. So we will be speaking about the background of nutritional anemia, the causes and effects in Bauchi State specifically, social determinants, our intervention proposal, solution evaluations, and our reflection.
So what is nutritional anemia? Nutritional anemia is when a person's red blood cell or hemoglobin concentration is lower than the typical amount. In Nigeria, more than 50% of the population experiences nutritional anemia, with the large majority being women and children. Someone experiencing nutritional anemia has many symptoms that may appear. Common symptoms include pale or yellow skin, muscle weakness, lack of energy, or confusion. In more severe cases, chest pain or angina, fainting, heart attacks, and a woman missing her menstruation may be experienced. These are just some of the many symptoms that are often seen. If nutritional anemia is left untreated, the health risks become more severe. If a pregnant mother is experiencing anemia, the risk of maternal and fetal mortality increases. In Nigeria, 37% of children from the ages of 6 to 59 months have experienced stunted growth due to nutritional anemia. This stunted growth can cause a 10-year-old child to look as though he or she is 5 years old, as well as the risk of experiencing cognitive impairments that can last a lifetime. Another severe risk, if left untreated, is heart conditions, with the largest risk being an enlarged heart muscle or even having a heart attack. Due to the lack of red blood cells, a woman is more at risk to miss her menstruation cycle. All these severe reasons are just some of the reasons why receiving treatment is so important.
Because Bauchi is one of the top states in Nigeria to struggle with poverty, communication of what can cause anemia or even worsen it becomes extremely difficult. Things such as malnutrition, chronic infections, parasites, and lack of nutritional health information make anemia easier to develop and harder to avoid. This can end in not only worsened infections already present, but can end in many heart problems and maternal mortality within pregnancy. And this is a vital problem because it affects not only the woman, but the potential health of the infant. Even if we can acknowledge that there is a problem with anemia spread in the Bauchi society, we must also be aware of what's already been done to help and what circumstances that were there prior. Knowing age and gender can affect anemia state, people must consider how women and children are more prone to anemia. This should enable sensitivity towards families as a whole and respect to their lifestyles. According to the World Health Organization of 2019, 50% of anemia cases in Nigeria are severe, with 68.9% of children having anemia. However, it is good to know that while organizations such as WHO, FAO, and the CDC have used plans to spread information about nutrients and accessibility, it has been stated that food fortification, also known as food strengthening, is one of the strongest strategies to help decrease the chances of anemic people and treating those who are unable to access medical help.
For our proposed intervention, we will host an educational workshop. Advertisement, food, and drinks for the workshop will be done by leadership initiatives. First, instructors and the audience will get to know each other. Then, instructors will conduct a pre-survey to evaluate the audience's prior knowledge on nutritional anemia. Then, instructors will go over the basics of nutritional anemia, its impact on Nigeria, and the solution, which will be on iron deficiency anemia, as it is the most common in Bauchi. Then, instructors will conduct a post-survey to ensure that the audience learned. Then, instructors will gather contact information for further evaluation in the future. Finally, they will distribute flyers at the end. Our flyer is right here on our slide. We acknowledge that not everyone in Bauchi is literate, so we included pictures to ensure that everyone gets the message. Then extra flyers from the workshop will also be displayed in markets and schools. The first part of our solution is to encourage the people of Bauchi to visit a doctor. Although people can conduct self-examinations and check for symptoms like coldness or paleness, it will not be completely accurate. According to the National Heart, Lung, and Blood Institute, people with mild or moderate iron deficiency anemia may not have any signs or symptoms. So that patient might have iron deficiency anemia, but they won't know it. So how does a doctor diagnose and treat iron deficiency anemia? Well, they will conduct a complete blood count test in order to find the degree of iron deficiency anemia, and the treatment is based on the degree. A mild degree would need oral iron therapy or a dietary modification. A moderate degree would need parenteral iron therapy, and a severe degree would need a blood transfusion. Finally, we will persuade people of Bauchi to visit a doctor by warning them about the complications and seriousness of anemia, and by telling them that only doctors can properly diagnose an iron deficiency anemia. We understand that the people of Bauchi don't have the same privilege as us to have easy and accessible access to healthcare. However, visiting a doctor is the only way to ensure that iron deficiency anemia will be diagnosed and treated before it gets too severe. As we stated before, people can eat iron-rich foods, such as red meat, to treat the early stage of iron deficiency anemia and to ensure it doesn't progress and become severe. We will encourage people who are less likely to consume iron-rich foods, such as women and children. In many cases, women and children don't have opportunities to eat iron-rich foods. In order to solve this without offending the people of Bauchi, we will advocate that everyone, especially women and children, need iron-rich foods, and we will inform them of the complications. Then we will encourage farmers to eat what they farm instead of selling everything they grow. According to Britannica, agriculture dominates the economy in Bauchi, which alludes that most people in Bauchi are farmers. For our solution, we will first look at the complications of anemia and notify them of the complications of anemia. And then we will also help them to eat the food instead of telling them to eat food. We will help them to get their food by informing them of the legume crop rotation process. It is a process in which legumes will be planted one year and another crop will be planted the next year in the same plot. Legumes are packed with iron, and they enrich the soil with nitrogen, and they will promote the growth of other crops which could also be rich in iron, such as spinach. Also, the Bill and Melinda Gates Foundation and the Tropical Legumes Project have promoted the planting of cowpeas in Bauchi, so the solution will be comfortable for farmers to adjust to. Overall, farmers will be able to grow more crops to the point they will be bound to keep some of their iron-rich legumes and crops for themselves as well.
Along with the pre and post surveys conducted within the workshop, we also plan to implement 2 surveys after the workshop, one in 6 months and another 6 months after that, making it a year. Doing so will help give us an idea of the impact our solution has had on Bauchi and if the audience really learned and implemented the solutions from our campaign. Our budget is $40. 20 of those dollars will go towards the education workshop where food and drink are included, as well as the advertisement done by Leadership Initiatives as previously stated. The remaining $20 will go to printing out 60 flyers. 30 of those flyers will be handed out at the community workshop for the attendees to take home, share with family and friends to really help spread the message. The remaining 30 will be hung up in markets and in schools to help reach a wider audience. After doing this campaign, our group has come away with a deeper understanding of nutritional anemia and the impact it has had on Bauchi, Nigeria. We have investigated and considered the causes and effects and the environmental determinants of health and social determinants of health as it relates to nutritional anemia as a whole and to Bauchi more specifically. Our campaign not only encourages the people of Bauchi to go to the doctor to receive proper diagnosis and treatment, but to also enrich their diets with iron by using the legume crop rotation method. We recognize that our proposed solution is recommending a change in lifestyle, but we hope to cooperate with the people of Bauchi to help uplift and support the community. Our role is to inform and encourage the people about nutritional anemia and treatment. While our team has worked very hard, we recognize that we will never fully understand or feel the hardships of those impacted by nutritional anemia. Our team tried our best to find the most effective and cooperative treatment-based solution for Bauchi. These are our sources, and on behalf of my entire team, I would like to say a huge thank you for listening to our presentation and giving us this wonderful opportunity.
Well, congratulations, ladies. Your work has been completed, I guess, for this participation in the 2-week-long event. Congratulations on conveying your excitement about during your presentation. I could tell that you had learned a lot this week, and you did a great job of sharing that back with us. I especially liked, and I think Morgan mentioned this too, I especially like the details that you shared about your educational workshop. It was obvious that you had put a lot of thought into that and how passionate you would be about educating the community there. So good work. Congratulations. And I hope you learned a lot. We learned a lot from you.
All right. Thank you, Nancy and Dr. Aisha.
Okay. Thank you, guys. Nancy has mentioned how, elaborate or workshop was, how you in out all these things. The talked about anemia prevention, but they to mention the iron-rich foods. They only elements, but you guys took it. I like how both groups kind of transitioned together, and you elaborated on the legumes, on the other items one needs to eat to supplement for iron and all of that. And also regarding farmers, encouraging them to actually eat what they produce, because that's a major problem. If you remember, I told you guys, it's a major problem. They do not know the components, the important they grow. The only thing they know is that I can use it as a get money, but they don't know that children need these things to grow, or a pregnant wife and all of that. So the fact that you guys did that out, it's very, very important, and thank you very much. One little observation. I think Manaswita, your icon reduced, like reading most of the time from a book. So we weren't, I wasn't feeling you. All was very important, but I feel your energy because I couldn't. Okay, but other than that, was perfect. Everything perfectly well. Very, very, very useful. Well done, guys. Excellent presentation.
Agreed. Thank you, Dr. Aisha. Mark, I just want to check in. Umar appears to have internet issues. Is he back in as an attendee?
He's not, but we can sit here and I can hold my hand up for 30 seconds if we want to try and wait.
All right. We're actually 2 minutes ahead of schedule, so I suppose we could wait and see. Let me reach out to him again. He was responding just via message, so I'm not sure whether it's just a problem with Zoom. Let me check in. Thank you for your cooperation here, everybody, judges and interns alike. All right, he's typing. All right, he says it still shows that it's just trying to connect. What about, okay.
Let's give him like another 30 seconds, and then if not,
Right, then we can go from there. Perfect. Thank you for understanding, everyone. All right. I think maybe what we can do if this doesn't work is we can speak to Umar afterwards, and maybe we can record his feedback and be able to include it in your video so that we can still get that third perspective for you. But hopefully he'll be able to join. Hey! Umar, welcome back.
Yeah, sorry about that.
No, thank you for being persistent with your internet. So Dr. Aisha and Nancy have provided some feedback already, so we were just wondering if you wanted to share any words with the group.
Okay. Sorry for the cut out of my internet, but you guys actually are listening to your presentation, and you did really amazing. And to be honest with you, like most of the people in the community are farmers. So your solution to the crop rotation, it's never going to be a problem. So maybe this is going to be like a new discovery to the community members. And I think your solution, like from the start up to the end, are actually on point. You guys have a very, very good energy in terms of your presentation. I like that. And sharing responsibility is always the best whenever you're working as a team. So you guys really, really did great. And I love the fact that your solution is entirely different with the rest of the team. Like you take a different dimension, different direction, I mean, and it's something that definitely is going to draw a lot of people's attention. And let me tell you, that your solution I'm talking about, the people in that community are going to help you to campaign to a lot of people. So you're making them to be like local doctors. So it's really amazing, and I'm really happy that you guys were able to research and come up with this incredible idea. And I can't wait to see it working here in Bauchi, and people are gonna love it. Like this is a natural thing, so there is no any argument about it. And based on the culture and the system, a lot of them, they actually believe in natural herbs, but you guys presenting something that it's really accommodating to them. It's interesting. So there is no question about it. There is no any argument or no any criticism about it. So this is something that they will be willing to accept it, and they will be willing to actually accommodate and start applying immediately to see if they can get the results you guys are talking about. So well done, nice work, and congratulations for this amazing presentation. I'm really proud of you guys, and I can't wait to see how this goes. Thank you.